Hello, my name is Stephen Parker. I'm pleased to be the chair of the upcoming Middle East Laser Summit, 21st to the 23rd of September, looking at the integration of laser photonic energy in all its forms within clinical dentistry, both for the everyday general practitioner and also the specialist. It's my great pleasure, by way of introducing keynote speakers, to introduce Professor George Romanos. In fact, he probably needs no introduction whatsoever, due to the many years, the decades of interest and publications that he has brought to the general dental population regarding the use of lasers in dentistry. He is Professor of Periodontology at Stony Brook University in New York, and he is one of our major keynote speakers. And George, welcome to this brief interview. I would like to start by asking you, in terms of your podium presentation, lasers in periodontal and peri-implant therapy, science or fiction? That's quite a question, science or fiction. So how do you see that?
Thank you, Steve, for this interview and this introduction. The problem of peri-implantitis is a big problem today worldwide. We know that we place implants across the globe in different countries, from clinicians and from specialists and general dentists. Implants are very successful treatment modalities. However, the incidence of peri-implant diseases is increasing, significantly increasing. And we know, according to the different studies from Europe and from the United States, that the problem is more of the implants, 40 to 45%, sometimes over 50% of implants have peri-implant problems, mucositis or peri-implantitis. If we look at the evidence and we talk about science here, there is no evidence in terms of the treatment approach we have today. In periodontics, we try to use different decontamination methods. We focus on the bacteria reduction. In periodontal therapy, we focus also on the bacteria reduction. But if we talk more about implants, we have also here the metal, which is the dental implant material, which has an association with the irradiation using different laser wavelengths, because we can reduce from one side the bacteria due to the heat transfer, but also stimulate tissues. So I started with this topic many years ago, as you said, in my career, where I used to live in Europe, almost beginning or middle of the 90s, focusing on treatment of peri-implantitis. And I have seen that we have possibilities to use different laser wavelengths, which do not overheat the tissues, are safe, and they can stimulate the bone formation. My first clinical case was 25 years ago, and I was excited to show clinically that the bone and bone grafting material was stable over the period of time. Of course, for 25 years, I was not waiting to see only this case for how long the bone is stable. I have used different wavelengths. I have used different power settings. I have checked very well, in depth, the literature from different people. And I come to specific conclusions that peri-implantitis therapy is a scientific approach using lasers, and this is not a fiction. And that's why I decided to give this title of my presentation, including the workshop in Dubai. And I'm excited to come and to be able to teach and to bring a maximum of my knowledge to clinicians who want to attend this meeting.
Well, I'm sure that all the delegates to the conference will be happy that you are wedded to the scientific theory rather than the fiction. But in terms of the two disease processes, the pathogenesis of periodontal disease, chronic periodontal breakdown, and also the incidence of peri-implant mucositis leading onto peri-implantitis. Do you see a parallel between the two? Do you see a common pathogenesis? Do you see that in terms of technique that your laser application has to be modified? How do you view this?
Thank you. So there is no long discussion about that. If we look at the studies by Mombelli in the 80s and beginning of 90s, we know that the bacteria which are associated with periodontal disease and peri-implant disease are almost the same. Certainly the host plays a very important role, And we have, different host response in a diabetic patient or a heavy smoker. But we forget that we have here the dental biomaterial, which is the tooth, not the tooth, but the dental implant. And the titanium is different than zirconium, and who knows tomorrow in the future what kind of dental implant materials we will use. But we have also a pathogenic response from the host due to the implant placement when we have soft implant materials like titanium, and we can have also titanium nanoparticles. So besides the bacteria, we have nanoparticles as well associated with peri-implant diseases. And this is what we see today. More and more researchers across the world are focused on this direction. When we clean implants, basically, with the standards of care, which is the curette or the ultrasonic or any other devices today, we know that we have peri-implant in the peri-implant tissues, titanium nanoparticles. Now, where is the laser and where the laser can be used in order to treat the disease? From the one aspect, we reduce the bacteria using the specific wavelengths. From the other side, if we can talk maybe later about the different wavelengths, but if we use in a safety protocol, we can stimulate the bone. And the recent studies from our lab, they showed that we have an increase of wettability, of hydrophilicity of the implant surface using laser radiation, which is something extremely unique. And I focused for the last 2 years in this in order to improve the wettability, to improve the bone to implant contacts after grafting using laser technology, something which cannot be done with any other technology as I know today.
Well, we certainly will agree that the impact of peri-implant disease is an almost ubiquitous challenge. It's a universal challenge in general dental practice. And for the average dentist who may have invested in a given laser wavelength, the challenge then is, how do I adapt my technique? How do I adapt laser tissue interaction in order to maximize and optimize the benefits? You would strongly, I hope, advise the technique sensitive nature of using lasers, the fact that they fit into a general treatment plan. But could you just perhaps briefly look at the range of wavelengths that may be applicable in treating peri-implant disease?
Thank you. The problem seems to be multifactorial. One problem is that clinical studies do not exist in the long term. The study should be sponsored maybe not by a specific company or specific wavelength, but should be sponsored by the universities. I would recommend personally to have more and more associations, scientific associations, promoting the technology and promoting science on this technology. The different organizations, it depends where you live. In the US, we have the FDA. In Europe, we have other organizations. From the legal standpoint, of course, every clinician can use the lasers, but always the discussion is if we have strong evidence. And the reality is, Steve, where I see as a clinician, educator, and researcher, the problem is we use in dentistry technologies and even methodologies which do not have evidence, and nobody discusses. Is there any evidence to use the Langer curette or the Gracie curette? There is no difference in the practice, and this is almost the standard of care. But there is always the conversation to use the laser, and generally speaking, laser, even we know very well, and we will focus on this in our symposium or in our congress, that laser wavelengths have complete different interactions with tissues and with the dental implant materials, with titanium, for instance. So this shows to me that we are very easy talking. We like to talk about against lasers because maybe we don't like to go back to the school and to learn about physics. And because there are no sponsors who can support research and development. And the companies develop and they try to sell without to have any evidence, any data, if I can say that in the most cases, any data promoting safety protocols. So I start basically going back to the school, if I can say that, with my team and evaluating the protocols. And I see there are risks in specific wavelengths. For instance, if you use a diode laser, it's not only one diode laser. We have so many. The 445, as a blue light is visible, The 810, the 940, 975, and 970, 980, they're completely different wavelengths. And we have seen interactions with the tissues, even if you use local anesthetics. If we use local anesthetics in the tissue, then changes the whole profile of their thermodynamics. And this can change the protocol from all of us clinicians if we know the negative effects and if we know the beneficial effects. So I don't want to focus now in this short conversation on which laser wavelength is maybe the safest, or maybe which laser wavelengths are safe under specific requirements, because otherwise maybe nobody will come to Dubai. And I want really to come and to bring all of us together and to clarify and to differentiate the risks and benefits of laser technology on peri-implantitis therapy. But it works and has long-term success, this protocol, in a non-surgical and in a surgical way of approaching the peri-implant disease, dependent, of course, of the architecture of the defect around implants and, of course, the etiopathogenesis of the disease. If it is completely different, basically is the approach. If you have a remaining cement underneath the crown on an implant, you remove the cement, you don't need to do anything. You don't need even curette or lasers. But if we have a peri-implant disease and progressive bone loss, then we have to do something in order to save dental implants.
Well,
I hope I give it, yeah?
Yeah, well, one thing is for sure, we acknowledge your very busy schedule. We certainly recognize your prodigious research record and publication record, and we welcome the way in which you are, without favor, able to discuss these delicate issues. It is a massive subject. It is a subject that cannot be ignored. And George, in thanking you for this brief interview, I welcome your visit to Dubai. We look forward to you coming, both to your workshop and to your main podium presentation. And we look forward to welcoming delegates 21st, 22nd, 23rd of September in Dubai at the Conrad Hilton. For the moment, George, thank you very much indeed for your time.
Thank you very much for having me. Have a wonderful day.